Ja, diese 24. Gesundheitsförderungskonferenz hat wirklich das Thema der Stunde den Nagel auf den Kopf getroffen und es ist umso großartiger, dass durch die Planung, die natürlich lang im Voraus passiert ist, uns daher auch gelungen ist, wirklich die Besten ihres Faches zu gewinnen, um Ihnen hier diesen Einblick zu geben in die Thematik, die eben heute im Fokus steht, nämlich wie man durch oder auch mit Gesundheitsförderung Klima schützen kann und natürlich auch, was reziprok der Zusammenhang ist. Wir freuen uns, Ihnen jetzt die ersten 2 Keynotes ankündigen zu dürfen. Es ist zunächst hier auf der Bühne Lisbeth Hall. Sie ist Senior Advisor Environmental Public Health am National Institute for Public Health and the Environment in Bilthoven in den Niederlanden. Ihr Vortrag wird auf Englisch sein. Noch einmal zur Erinnerung, Sie können, wenn Sie online dabei sind, auf den deutschen Kanal wechseln. Wenn Sie hier im Saal sind, bitte fühlen Sie sich eingeladen, ein Mikrofon und ein Übersetzungskastel sozusagen mitzunehmen. Der Titel Ihres rund 30-minütigen Impulses, The Climate Crisis, a Health Crisis. Happy to have you.
So good morning, everybody, and thank you very much for inviting me to this beautiful city of Linz. And congratulations to the organizers for their impeccable timing of this conference, just when we're having really early heat waves all across Europe. So I'd like to talk you through what's going on in climate change and the climate crisis and how that's affecting our health. And I'm just curious, how many of you are actually involved in climate and health at the moment? How many of you are working on that? Show of hands. Okay, oh, excellent, excellent. That's at least half the people in the room. Brilliant. So maybe by the end of this conference, everybody will be convinced of how important this theme is for our health. So I try and keep up with the news on climate change, but really it's impossible to keep this slide up to date because there's always things going on. We had incredibly early and very extreme heat waves in Pakistan and India early this year. Now there's flooding in India. Parts of the Atlantic ice shelf were collapsing because of very, very high temperatures in the Antarctic. And there's also been flooding in Brazil. So you might think there's always been flooding, there's always been heat waves, and that's absolutely true. But what we're seeing is through climate change, these events are getting more frequent and more extreme. So if we look at how we are warming our planet through industrial activity, so this is the temperature compared to pre-industrial times. So you see we're now on the year 1926, and gradually the climate is warming up because of the emissions of greenhouse gases through our human activities. And what you'll notice is that certainly the last few decades, it's really warming up more and more. And especially over land, and especially over the Arctic, and as you can see, over Europe. And at the moment, the global average warming is 1.1 degrees C, but over Europe, well, certainly in the Netherlands, it's already above 2 degrees C. And again, you might think, doesn't sound like much, but that's the average warming, which means that the extremes, so like the maximum minimum, are changing much more, and that's what we need to worry about. And if I look at the temperature change, I found this temperature change in Austria, and here you can see what the temperature change is relative to an average between 1971 and 2000. Climatologists always work over a period of 30 years, so they're always comparing long-term weather patterns and temperature change. And here you can also see that there's the last few decades, there's increasing warming, and again, an average of about 2 degrees warming, so similar to what we're having in the Netherlands. And this year and last year, we had some groundbreaking reports again from the International Panel on Climate Change, giving us an update on the state of the science and on what we can do to combat climate change and also the effects it's having on humans, on nature. And as you can see, here they're showing different scenarios. And at the moment, we're on, like I said, 1.1 degree C. But if we follow the high emission scenario, so that's the higher the lines there, you can see that we're well on target to, well, we're absolutely not on target. We're going well above target and reaching a much higher climate change than if we're going for the more sustainable scenarios. So that's the the SSP1, the lower ones. And where we are at the moment is that middle scenario. So that's not very good, in fact. So we really want to get in a more sustainable curve so that the temperature is going to go down again, and we're going to stabilize this global warming. And of course, the IPCC also stated, as if we needed reminding, that it's definitely human influence that has caused this unprecedented change in the climate and in temperature. And very recently, just in May, the World Meteorological Organization said that we face a 50% chance of warming of 1.5 degrees in the next few years. And that is, as you might remember, one of our targets set in the Paris conference to limit climate change to 1.5 degrees. So obviously, we're really not doing enough. And if we look at sea level rise, again, at the moment, we're on about 20 centimeters sea level rise. By the end of this century, on that kind of middle range scenario that we're on, we should be reaching about 70 centimeters. But there's also a chance of a so-called low likelihood, high impact scenario, where if the ice sheets start melting faster and faster, then you might get a sort of a runaway effect and really high sea level rise. Again, something we really need to avoid. Even by the end of the century, a lot of coastal communities and sea island nations will be affected by current climate change. And even now, in fact, I know in Britain, for example, that coastal communities are very threatened by sea level rise and by the storms, sea storms. And as you see on this graph, on the right-hand side, that is a sea level rise in 2300. It's not the same scale because it wouldn't fit on the slide otherwise. And that might seem like a long time ago, away in 2300. But if we look back in time to 200 or 300 years ago, that's well within our kind of historic cultural memory. I mean, I walk around Linz and I see lots of buildings from more than 200, 300 years ago. So it's not that far away. And very recently, the EU published this State of the Climate of 2021. And again, as you can see, many records were broken in Europe. We had a massive rainfall in July in Germany and Belgium, in the Netherlands, with loss of life, terrible conditions for people in Belgium and Germany. But also there were record heat waves and droughts across Europe. So what does this mean for health? In the middle, you see those climate effects I was talking about, the rising temperatures, the rising sea levels. And then in the second circle, you see the effects this is having on hazards for us, exposures, things we might be exposed to. So things like the severe weather, but also an increase in allergens, environmental degradation in parts of the world, impacts on our water quality, on food supply. And then you will see on the outside what that does to our health. So increased cardiovascular disease due to air pollution, increased respiratory disease due to increased allergens, but also vector-borne diseases like Lyme disease or malaria can be increasing in parts of the world. So I'm just going to go through and unpack some of these things in more detail. But first of all, I'd like you to have a look at this so-called risk propeller. And there you can see that risk or the risk of an impact is dependent, obviously, on the hazard, for example, heat. But obviously, you need an exposure to have an impact. So, for example, if you live in a hot country, but you go from your air-conditioned house to your air-conditioned car to your air-conditioned office, you won't get exposed to heat, so you won't get the effects. So exposure is very important, as is vulnerability. And as I heard people mention earlier, vulnerability is a very important factor. Some people are more vulnerable than others. And if we look at vulnerability factors for the health impacts of climate change, you can see that these can be biological factors. Some people can have chronic diseases, so be more vulnerable. Demographic factors like the elderly can be more vulnerable. But also socioeconomic factors, well-known determinants of health, like poverty, reduced access to education, People might not be aware what they should be doing when there's a heat wave, for example. And also geographical factors, living on a floodplain, living in a drought area. So these are all very important factors, certainly for the health community to take into account, because these are factors, of course, we can work on. These are levers for our work on climate change. So if I move on to some of these health effects, I'll start with the heat-related effects of climate change. And as I said, we expect these effects to get more intense and more frequent. And 50% of the world's population now lives in the urban environment, and the urban environment has the so-called urban heat island effect. This is because the urban environment mainly has a lot of concrete buildings, and it absorbs heat and it retains, it keeps that heat, which means, especially in the evenings, it doesn't cool down. And in the rural environment, because of all the greenery, it cools down much more. And in the Netherlands, we found that upwards of 7 degrees difference between the urban and the rural environment on a summer evening. So, of course, an urban community is going to be much more affected by heat. So that's something to bear in mind and something to work on, of course. And, of course, one of the effects that you hear the most about, of course, the deaths in the summer due to heat. And in the graph at the bottom, you can see the relative risk of death in the Netherlands at different temperatures and ages. And there's kind of a minimum mortality temperature, so when the least number of people die, and that's between 16 and 18 degrees. In warm countries, that might be slightly higher because people are adapted to the heat, and in cooler countries, slightly lower. And what you see is as the temperature gets higher, more people will be dying, and especially the elderly. So there's a real difference in age groups. And also, as it gets colder, you see more deaths. And this is not necessarily due to the impact of the cold, but due to the fact that in colder periods, we're all indoors more often, you get indoor crowding, and then there's more transmission of infectious diseases like flu, like we've seen with corona, for example. But the increasing mortality due to increasing temperatures is really to do with that heat exposure. Obviously, there's also heat stress. And we also need to be mindful of interactions with other things like air pollution. In the summer, there might be smog in the cities. People that are working outside, they're very exposed, so labor productivity can decrease. But also people, office workers, you can get decreased concentration because you're sleeping so badly at night. And as I mentioned, the vulnerable groups. And there's recently been a lot of interest in the attribution, how much of these effects can be attributed to climate change. And there's been a recent paper when they looked all around the world at the statistics, and they calculated that 37% of deaths in the last few decades can be attributed to climate change. And we were part of this study. In the Netherlands, we're around about 31%, but worldwide, there was an average of 37% of deaths. So if I move on to pollen allergies and climate change, we see that the pollen season is starting earlier and can be more intense. And that depends on the species, also depends on the country. There are some variations. For example, in the Netherlands, we're seeing that the tree pollen season, especially the birches, ash, hazel, they're all flowering earlier, but also ending earlier. But in general, the pollen concentrations are increasing. With the grass pollen season, that's extending. It's starting earlier and it's going on for longer because the growing season is increasing. As you see in the graph at the bottom, you can see that in the Netherlands, the growing season has increased by about 3 weeks since pre-industrial times. And we expect that under different scenarios, that's the second graph, that growing season will continue to increase by 20, 30, 40 days by the end of the century. There's also been some studies in more laboratory situations or in greenhouses where you see an increase in allergenicity of pollen. So it becomes more allergenic with more CO2 in the air and an increase in pollen production of plants. How that's going to pan out in the real life environment, we don't know yet. We also see a spread of species that might be new to our countries. I think in Austria you have ragweed. In the Netherlands we have it since the last decade or so, which was it's not an it's something we had before, and that's very allergenic and also increases the pollen season because it comes into flower at the end of the season. Olive trees, that's a more consumer-led trend. A lot of people are now buying olive trees, and they actually survive a Dutch winter, whereas they would never have survived a Dutch winter before. But because of climate change, our winters are getting milder. And olives produce very allergenic pollen, and that's new for the Dutch population. Mediterranean countries are already used to this, but this will be, could get to be a problem if we have a lot of these trees. Obviously, this leads to an increase in the frequency and severity of people's hay fever symptoms. So if we move on to vector-borne diseases, so these are diseases that are transmitted by an insect such as a mosquito or a tick between a mammal or a human and another human. So things like dengue, malaria, Lyme's disease. And we're seeing that the climate is becoming more favorable for the distribution of some of these species. And as you can see on this map, the difference in 9 years between the distribution of the Asian tiger mosquito, which can bring dengue and chikungunya. And before, it wasn't established in countries like France, or barely established in France or Spain, whereas now it is, and also in Italy. And in the Netherlands, it's been introduced. We're also seeing more climate suitability for the transmission of infectious diseases. This is kind of a very complex interplay of the host, the transmission cycle, and there are lots of other factors that play a role. So it's not just climate change. It's also things like land use, also our behavior. If we're out in nature a lot, of course, we might be more likely to get tick bites. And also public health. If our surveillance is very good, if our vector control is very good, then we can keep on top of these things. So climate is one of many factors that influence the transmission of vector-borne diseases. So if I now move on to UV radiation and climate change, in the Netherlands, as in many European countries, there's been an incredible increase in the incidence of skin cancer the last few decades. If you see here in the graph, the incidence of all cancers in the Netherlands, that's the relative incidence, that's the blue line. For melanoma, the most dangerous form of skin cancer, that's the red line. And the squamous cell carcinoma, a slightly less dangerous form, is the yellow line. And you can see that melanoma, that's increased threefold in the last decades. And obviously, this is also very much a behavioral thing. We love sunbathing. We love going to countries with a lot of sun. But we think that climate change might be playing a role as well. In the Netherlands, we're seeing less cloud cover, which means there's more UV radiation coming down. We're also seeing, especially in the spring, more days with warm, sunny weather, which means people are more likely to be outside, recreation, and being exposed to UV. And through this, and if you're not protecting yourself well enough, then you're more likely to get skin cancer. So these things, again, making sure that I think this is also sort of a health promotion thing, making sure that people are very aware of what they should behave, how they should behave to avoid getting skin cancer. If we now look at the health effects of extreme weather events, things like extreme rainfall can lead to an overflow from sewers. And if people, like children, might be playing in that flood water, or people might be cleaning up their houses and get exposed to these pathogens, and that can lead to an increase in all sorts of gastrointestinal or respiratory infections. Also, higher temperatures is not not exactly an extreme weather event, but I include it because that's something that we see a lot in our countries. Due to higher temperatures during a long period of time and more nutrients in water, we get more blue-green algae in lakes and ponds. And if people go swimming, which people like to do, of course, on a hot summer day, you're more likely to get skin complaints, rashes, and gastrointestinal problems. We're also seeing across Europe a real increase in wildfires, which apart from losing the loss of maybe of life and possessions, also leads to terrible air pollution, and often for days or weeks, which can lead to respiratory and cardiovascular complaints and even death. Also, extreme weather events can have a real impact on someone's mental health, and that leads to me to my next slide. So impacts on mental health is something that has been researched the last decade or so. It's very much an emerging issue when we talk about the health impacts of climate change. So extreme weather events, if you are exposed to extreme weather, you might lose possessions, you might even lose your loved ones, you'll lose your home perhaps, you'll be evacuated, you don't know when you're coming home again, and then you have all the bureaucracy, the insurance, and this has a real impact on people's mental health. It's very stressful, it's very traumatic. So they need support to deal with this. We also see when there are higher temperatures, there are also effects on mental health. We see more aggression and more suicides, and especially people who have mental health complaints are more susceptible to heat. And this is to do with their medication. They often take medication that means their thermoregulation, so how they can regulate heat in their bodies, is reduced, which means they get more complaints. You see more of them presenting at accident and emergency in the hospital. We also see, particularly under young people, that the idea of climate change, all the news they hear about, how that's going to affect their future, also has an effect on their mental health. And this is normal, having this hanging above you, that it's going to affect your mental health. They're getting so-called eco-anxiety, climate anxiety. So this is something we really need to pay attention to. So that's the indirect effect of climate change on mental health. And also at community level, especially amongst indigenous populations, for example, farming communities, when their livelihoods are being affected, we see that there's more suicide, for example. So it also has community level effects. Right, so are you ready for some good news? I'm sorry, it's all been a bit negative up until now. So it's very important that the health community is involved in climate measures, because there's also a lot of good news for health, so-called co-benefits to health. So if I begin with the co-benefits of mitigation measures, so the measures to reduce our greenhouse gas emissions. So through decreasing our use of fossil fuels, we're going to reduce air pollution. Now, air pollution is the biggest killer in Europe of all environmental factors. So this is really good news for us. If we can reduce that air pollution, we will reduce respiratory and cardiovascular disease and mortality. Also, active travel, I've heard that mentioned earlier, and I think there's a workshop on it later, is very important. Encourage more cycling, more walking, and then people will have more physical exercise, less cardiovascular disease, less obesity, less diabetes. Very important for health. Meat and dairy production accounts for 15% of our fossil fuel emissions. So working on that is also really important. And of course, eating less meat is really healthy. So that's also a big win for health. So healthier diets, healthier people. So 3 really big wins for health. And we calculated in the Netherlands what the co-benefits of the Dutch mitigation measures would be in 2050, and we came to about the highest calculation, 20,000 fewer disability-adjusted life years. So that's how we calculate the burden of disease per year. So that's a really good health co-benefit, a really good health advantage there. So it's very important that the health community is on board and making sure that this argument for these mitigation measures is heard. The health argument needs to be heard. It's also very, very important that we make sure that there aren't any unintended consequences for health. For example, you see a lot of people converting to biomass burning, wood-burning stoves. They increase air pollution, so that's not the way we want to go. Also, big wood-burning installations increase air pollution. So we need to be there advising on this. And also when improving buildings, improving the insulation, of course, that's really good to make these buildings more energy saving, reduce the energy bills of people. But we also need to ensure good ventilation options, good means of cooling the building. making sure the indoor air quality is good. And also things like noise pollution. We're seeing with, for example, heat pumps, these new means of warming houses, they actually cause quite a bit of, or they can cause some noise pollution. And of course, wind turbines, people are really affected by them. So make sure that the health community are there talking about these things, and also get communities on board so then they can discuss where to site the wind turbines, for example, so that they'll be more in favor of them and not protesting about them afterwards. So that's a thing to keep an eye on. And if we look at the health co-benefits of adaptation measures, because of course climate change is here, it is now, it's going on, so we need to adapt to it. And what you're seeing is a lot of great initiatives, and I was so pleased to see when I came into Linz by train and I walked through the Volksgarten, which was full of, and it was a boiling hot afternoon, and everybody was in the shade of the big trees and in this lovely park, and also along the Danube. I saw a lot of very big trees so people could enjoy the shade and have reduced heat stress. And that's very important, that urban greening, especially because of that urban heat island effect. And this not only reduces heat stress, but greenery also has a really good impact on our mental health. It restores us, it reduces our stress levels. So again, another win for health. And of course, greenery also promotes physical activity. People will be cycling and walking. And as I saw in Linz, they will be talking to each other, a lot of social contacts in green spaces. But again, things to watch out for. It's really important to have accessibility and equity. Poor people need to have access to these green spaces. They mustn't just be in the more affluent areas. In the Netherlands, we say that everybody should have an access to green space within a couple of hundred of meters of their home. And also for the people that might not, the elderly, for example, that might not be able to walk very far. So accessibility, equity, and of course they need to be well maintained, they need to be safe, need to have spaces to meet, nice benches, which I have seen everywhere in Linz, loads of great spaces for meeting. And yeah, the poorest neighborhoods are often the warmest neighborhoods, so those need to be the places that have these green spaces. And obviously when urban greenery is planted, make sure to avoid allergenic species, so don't plant lots of birch trees. And again, this is where the health community can talk to urban planners and or the urban landscapers and make sure they're not planting allergenic species. And also consider how it might affect insect populations. You don't want places to encourage ticks, but also blue spaces is very important too, but they need to be well maintained to also not encourage, for example, mosquitoes. So an integrated approach is very important. We need different people from health on board, from vector-borne, from infectious diseases, people who know about allergies, and they need to be talking to the other communities. So that intersectoral approach is very important to maximize the health benefits and minimize possible unintended consequences. So that brings me to my last slide. So what have we learned from our work in the Netherlands? We would say that climate change is obviously already having an impact on health, and these are increasing, will certainly increase in the future. And I think we can also call it a health crisis, especially for vulnerable populations. And especially in poor countries, sub-Saharan Africa, etc., it's very much a health crisis. And it's very important that the health sector is on board presenting the health argument for these measures, for the mitigation and the adaptation measures, to maximize those co-benefits for health, maximize those wins for health, and also to keep an eye on the negative effects or the possible negative effects. And again, when developing and implementing measures, we need to be there at the beginning, not at the end giving our advice. Make sure that there's an integrated intersectoral approach and that that health perspective is there from the start. So I end with a sunset in the Netherlands and a lovely meandering river. Thank you very much.
Thank you very much. Thank you very much. And indeed, ich wechsle jetzt nur auf Deutsch, damit das mit der Übersetzung gut hinklappt. Ja, in der Tat ist, glaube ich, noch nie ein so intersektionales Konferenzthema gewesen wie heute, wo ganz klar wird, welchen zentralen Bestandteil Gesundheitsförderung hat und durch welche Faktoren aber Gesundheitsförderung auch erst möglich gemacht wird. Ja, wir haben heute hier nicht nur Dolmetsch in andere Sprachen, sondern auch in eine andere Kulturtechnik, nämlich in das Zeichnen. Und ich darf jetzt ganz kurz schalten zu unserer Graphic Recorderin, die schon fleißig am Festhalten ist. Ich denke, Graphic Recording is something you know, ja, nice. Etwas, was Sie auch kennen. Es ist ein wirklich schöner Bestandteil der Konferenzen des FGÖ mittlerweile und ich darf jetzt schon ankündigen, dass natürlich dann die gesammelte Zeichnung aller Beiträge des heutigen Tages Ihnen allen im Anschluss zur Verfügung gestellt wird. Ja, also hier sehen wir eine bildliche Zusammenfassung und vielleicht lassen wir die auch noch ganz kurz eingeblendet, bevor ich oder während ich Ihnen hier im Saal nun die Möglichkeit bieten möchte, entweder Erfahrungsberichte aus Ihrem professionellen und expertlichen Kontext oder auch Fragen an Lisbeth Hall zu stellen. Dann sind Sie bitte jederzeit von uns mit einem Mikrofon versorgt, sobald Sie die Hand heben oder ein anderes Zeichen Ihrer Wahl wünschen, dass es uns möglich macht, Ihnen ein Mikrofon zu bringen. Da ist eine Hand, bitte schön, das Mikrofon kommt zu Ihnen, wenn Sie es nur so lange oben lassen, genau, bis man Sie auch sicher identifiziert hat. Und wenn Sie so lieb wären, uns vielleicht auch den Namen oder auch die Institution sagen. Bitte schön.
Guten Tag, mein Name ist Karin Leitner von der Arbeiterkammer Oberösterreich. Wir haben gerade eine Studie durchgeführt zur psychosozialen Situation der Oberösterreicherinnen und haben festgestellt, dass vor allem junge Menschen bei uns ganz große Zukunftsängste haben. 70% haben im Grunde keine Hoffnung mehr auf ein Bestehen in der Zukunft. Und das hängt, wie Sie ausgeführt haben, sicherlich auch mit den multiplen Krisen zusammen, mit denen wir konfrontiert sind. Und viele haben angegeben, dass sie sich von öffentlichen Institutionen, vor allem der Schule, aber auch Politikern, im Stich gelassen fühlen, nicht gehört fühlen, nicht repräsentiert fühlen. Und deshalb hätte mich interessiert, was sagen Sie zu diesem Ansatz? Wie kann man die Jugendlichen, vor allem die jungen Menschen, es betrifft auch Ältere, aber vor allem die jungen Menschen abholen, mitnehmen, ihnen eine Stimme geben?
Herzlichen Dank für die, glaube ich, ganz wichtige und auch
Yes, thank you very much. We've seen the same in the Netherlands because we recently monitored mental health amongst young people in the Netherlands, and also because of the corona crisis, and we saw the same, that the mental health of young people has really decreased the last year or so, and we also know that climate change plays a role in that. And I think, and I don't work with young people myself, but I think what I've read from the literatures, you see that if you actually engage them in the problem and give them actions that they can take to make an impact, that does often help them. They feel that they're, more in control. They're actually doing something. They're doing something to improve the state of the climate. So I think that's very important, that there are, of course, measures they can take, measures we can all take. And if they feel that they're part of a community taking those measures and feel more empowered, I think that can help their mental health. And you see those people, and I know there was a recent study putting young people into typologies, and in that group that were active and felt in control, they had the best mental health.
Also eine Frage der Beteiligung und sozusagen auch natürlich des Engagements als Bestandteil. Bitte schön, noch eine Frage hier aus dieser Reihe, bitte.
Ja, mein Name ist Birgit Langeder und ich arbeite für die Volkshochschulen und wir haben 260 Volkshochschulen in Österreich. Ich arbeite für den Dachverband und wir bieten sehr viele Programme von Gesundheit bis über den zweiten Bildungsweg für erwachsene Lernende. Erwachsenenbildung ist grundsätzlich auch für Menschen, die vielleicht zu vulnerablen Gruppen gehören, die im ersten Bildungsweg vielleicht nicht so den Zugang zu dem Bildungsziel hatten, das sie wollten. Und jetzt frage ich Sie, Frau Dr. Holl, welchen Ansatz würden Sie für die Erwachsenenbildung am ehesten empfehlen? Also wie gesagt, das sind abgesehen von Gesundheitsprogrammen auch viele, viele Sachen in der Basisbildung, in der Alphabetisierung, in der Bildung am zweiten Bildungsweg. Viele Leute kommen auch aus anderen Ländern, aber wie gesagt, viele sind Menschen, die es am ersten Bildungsweg in der Schule nicht so einfach hatten.
Wichtiger Punkt, herzlichen Dank. Wir warten noch kurz, bis übersetzt wird. Falls es noch Wortmeldungen hier im Saal gibt, dann bitte jetzt. Ich würde dann sonst zum Online-Bereich schalten, ob dort Wortmeldungen sind.
Okay, I think I've understood the question. So in terms of climate change, I think it's really important that people are aware of what sort of adaptation measures they need to take. So I think, you see with heat waves, we often have, you probably have public health campaigns, but not everybody has accessibility to that information or knows exactly how to behave. So they need to be aware of how to behave. They might not have access to the heat warning systems. So I think making sure that they know what to do when you have an extreme weather event, I think that's very, very important. But also knowing what they can do, of course, to mitigate. But I think disadvantaged people, it's normally the greatest impact can usually be made by the people who are more affluent, and disadvantaged people probably have a lot more things to worry about than mitigating climate change. So I think perhaps, obviously it's important they do that, but I would focus on what they need to do to adapt so they don't get the health impacts of climate change, because they probably have enough, health worries.
Also auch hier Information, möglichst niederschwellig und ganz sicher auch das Befähigen, diese Information weiterzugeben, wenn ich das vielleicht noch mit hineininterpretieren darf in meine Übersetzung des Gesagten. Ja, liebe Birgit, ich darf jetzt kurz zu dir schalten und fragen, ob es im Online-Bereich, im Chat-Bereich der über 100 Teilnehmerinnen und Teilnehmer, die online heute dabei sind, Fragen gibt an Lisbeth Holl.
Ja, vielen Dank, liebe Sonja, und ich starte mit einem kurzen Stimmungsbild aus dem Chat. Es ist rege und aktiv diskutiert worden. Es waren doch auf einigen Seiten auch technische Herausforderungen, und da ist etwas sehr Schönes passiert im Chat, in der Online-Community. Ganz viel soziale Unterstützung, gegenseitig Tipps und Hacks, wie hier damit umzugehen ist. An dieser Stelle vielen Dank an die Online-Teilnehmenden. Und nochmal die Versicherung, dass wir uns selbstverständlich um Ihre Anliegen kümmern. Ja, und es gibt viel positive Resonanz auch auf den Vortrag von Lisbeth Holl. Dankeschön, ein großes Dankeschön auch für das hoffnungsvolle Bild, das unsere Referentin gezeichnet hat. Und eine konkrete Frage, die ich hier herausfische: Gibt es Erklärungsversuche für die starke Erderwärmung über dem Nordpol?
Herzlichen Dank, liebe Birgit. Die Übersetzung läuft. Gibt mir vielleicht noch kurz die Gelegenheit, jetzt doch den Schleier zu lüften. Heute früh ist die Videoplattform Vimeo weltweit abgestürzt, so wir auch mit Ihnen. Wir hoffen, Sie haben es nicht wirklich hier bemerkt. Wir mussten den Streamingdienst wechseln, und daher nochmals herzlichen Dank für Ihr Verständnis. Und es ist schön zu hören, dass die Online-Solidarity so funktioniert, dass alle einander unterstützen, und jetzt läuft alles gut. Bitte schön, Lisbeth Holl.
Yeah, I think the question was why the North Pole is warming more. And unfortunately, I'm not a climatologist, so I don't know exactly why that is. I think it's probably something to do with the Gulf Stream, but no, I'm not even going to hazard a guess. Maybe one of the other German speakers,
Ich denke, wir werden vielleicht diese Frage, liebe Birgit, dann auch noch mitnehmen zu den beiden anderen Vorträgen. Vielleicht trotzdem von mir noch ganz kurz, noch ganz kurz abschließend. Sie haben, Frau Holl, ganz bewusst auf die sozusagen Vernetzung der verschiedenen Disziplinen hingewiesen und auf die Verletzbarkeit von gewissen Personengruppen versus anderen. Ja. Ja. Das ist ein Zeichen der Ungleichheit, der großen Ungleichheit auf dieser Welt. Jetzt sind wir hier mit ganz vielen Expertinnen und Experten aus dem Bereich Gesundheitsförderung. Was könnte auch aus dieser Community heraus der dringende Appell sein, dass mit einer ungleichen Welt wir weder die Gesundheitsförderung und erst recht nicht den Klimawandel gut in den Griff bekommen.
I think, if I understand your question correctly, you're saying how can the health sector get involved? So I think we need to talk to our counterparts at all levels, so at national level, at regional level, at local level, within municipalities, provincial governments, national governments. So you need to be talking to people from environment. Like I said, the urban planners. We need to be people from food producers, agriculture. The health sector just really needs to be on board with those discussions of how you're going to mitigate climate change in Austria. And it's also very good to connect. There's all sorts of, working groups, international working groups, which is also good to connect with. But I think, and it's really difficult, I must say, it's really difficult because the health sector, we don't have a very loud voice at the moment. Also in the Netherlands, and at my institute, we only developed a strategy on climate change and health 3 or 4 years ago, and we started off within our institute, because we're a big institute, we do infectious diseases, we do public health, we do the environment, but we needed to find out what we were all doing within our own institute. So we got a community of practice together, so at least we knew what we were doing, and so we can amplify our own effect, and then we can go out to the and talk to the ministries, advise them, and be a part of this. So you need to build it up from your own institute and get your knowledge, at a good level, and then. But it's not easy. It's really not easy. And I think now we are being seen as a player in the Netherlands, that they need to have us on board when they're discussing, measures and actions in our national adaptation plan, for example. Mm-hmm. Yeah.
So really get in contact with the counterparts, get united with the community.
Yeah, absolutely.
Ja, thank you very much. And nicht nur die Online-Community ist solidarisch und hilft einander beim Beantworten von Fragen, sondern auch on location. Ich darf an Herrn Professor Hutter kurz übergeben für die Antwort der Frage, die im Chatbereich an Lisbeth Hall gegangen ist.
Ja, das ist relativ einfach. Ich meine, so einfach ist es nicht. Früher hat man gedacht, das ist der sogenannte Albedo-Effekt. Das heißt, wenn die Sonnenstrahlung auf eine weiße Oberfläche trifft, dann strahlt das ab. Nachdem es immer weniger weiße Fläche gibt, erwärmt sich das. Das ist sicherlich ein Beitrag, aber es ist nicht alles. Es ist deutlich komplexer. Währenddessen in den Äquatornähe steigt die heiße Luft viel schneller auf. Und die dichtere Luft über den Polen verursacht Folgendes, nämlich dass diese wärmere Luft nicht sehr schnell aufsteigen kann. Sie vermischt sich und bleibt näher an der Erdoberfläche. Und von daher gibt es eben auch diese höhere Temperatur, die dann auch zum Abschmelzen oder zur Erwärmung deutlich mehr beiträgt.
Ein klassischer Teufelskreislauf.
Bitte?
Ein klassischer Teufelskreislauf.
Ja.
Herzlichen Dank jedenfalls, Professor Hutter, für diesen Assistenzeinsatz hier beim Vortrag Lisbeth Hall. Danke jedenfalls Ihnen und danke auch vor allem für die klimafreundliche Anreise per Zug. Und schön,
Entschuldigung, dass Sie nicht in Deutsch haben.
Also, wir danken, dass Sie uns den Vortrag so fantastisch mitgebracht haben, Lisbeth Hall.
Danke.